And the Republican-led Senate has not prioritized moving forward on providing relief for the past several weeks since. Here at NILC, as co-chair of the Protecting Immigrant Families campaign, we've been urging senators to take action quickly and to consider provisions that halt the public charge regulations that allow immigrants in all states, and particularly those with low incomes, to receive COVID-19 testing, treatment, and vaccines, particularly through emergency Medicaid, to remove barriers to nutrition assistance and other supports, to protect immigrants from enforcement at healthcare facilities and other sensitive locations, and to ensure that language access is not a barrier to care and support systems. 40 plus million people are out of work and struggling to pay their bills, and previous legislative fixes have specifically denied immigrant and mixed immigration status families from the stimulus payments themselves. And so we need to provide cash payments to individuals who file their taxes with an ITIN and create a process for those who are not required to file taxes but are otherwise eligible. Next, I think we just need to ensure, as Dr. Turner-Llovera said, we need to ensure that immigrants and their families feel safe in entering the facilities themselves, like healthcare centers. Currently, there are no provisions in any previous bills that prohibit U.S. Immigration and Customs Enforcement, or ICE, from conducting immigration enforcement at these sensitive locations. And lastly, people just need to understand what's going on and be able to access information about their healthcare and other options. And we cannot make lack of language access a barrier to one's ability to learn about the availability of and their eligibility for healthcare and other services. And this is particularly important given that in the US, more than 25 million people are limited English proficient. So just in closing, to take a step back, I just want to reflect on the growing movement for Black lives and the growing hate incidents and violence for against Asian Americans and Pacific Islanders because of the president's statement, right, calling COVID-19 most recently as the Kung flu. I would just I think I would characterize our current political moment as a convergence of two pandemics, the health pandemic as one, and the other pandemic of anti-Blackness and racism, when considering its disproportionate impacts and discrimination on communities of color. Our communities really, and you've heard it today, have been and are profoundly affected by the pandemic. We're actually at the epicenter of those who are infected and dying, those who are unemployed and excluded from relief, and there's a disproportionate number of us that are essential workers. We are also at the epicenter of the pandemic of anti-Black police violence. And so the Trump administration's immigration policies continue to terrorize our communities, and the result has been a toxic brew that hurts all of us, regardless of where we are born. Systemic inequities have really glaringly been laid bare by COVID-19 as a function of white supremacy. And really, we believe that our current healthcare, police, and economic support systems do not serve our country. The response nationwide to providing information with regards to the services that are eligible to these communities have really been lackluster in terms and incomplete, right? In terms of providing a comprehensive understanding is in several languages, including API languages, about what types of federal relief are available to folks. And so, that's one of the things, not just I think with regards to Congress and the relief packages that have been passed in the past several months, but also by USCIS. They did issue a guidance that basically talked about how COVID-19 testing and treatment would not be considered within the context of public charge, but it was merely just a statement in English on their website. There was no attached outreach efforts really in several languages beyond that.